Okay, the next DNA virus we're going to talk about is pox virus. Pox virus, remember, doesn't pay attention to any of the rules. It's a large DNA virus, it's enveloped, but we're not sure of the morphology, so we call it complex. Pox virus replicates in the cytoplasm. It's the only DNA virus that does that. And if you think about it like this, you ever go on vacation and pack like way more clothes than you need? And why do you do that? Because you never know what situation you're going to find yourself in, right, ladies? You could be going out, you need this outfit. You could be doing this, you need this outfit. So you pack like a monster suitcase for a weekend, okay? So you are prepared for any scenario. That's what pox virus does. It takes anything it could possibly need with it so it can replicate in the cytoplasm. It doesn't have to go to the nucleus because it was prepared. It took everything it needs with it and can replicate in the cytoplasm. Now, the other thing with pox virus is it is the largest of the viruses, almost visible with a light microscope, okay? Not like you're going to do really well with that, but again, mostly it's electron microscopy for visualization of viruses, but that just kind of lets you know how big this one is. And we're going to talk about smallpox first, because again, smallpox virus is really probably duking it out with anthrax for number 1 and number 2 spot for potential biological warfare agents. The viruses we're really going to focus on are variola, which causes smallpox, and we'll mention vaccinia. And then we're going to take a look at molluscum contagiosum, and this is listing some of the other viruses that are really a lot less common than molluscum contagiosum. So with variola, we know smallpox is a virus that has one serotype, which has made eradication possible. This is currently the only pathogen by which we have 100% eradicated from the entire globe. Now that is an amazing feat. It's partially because of one serotype, partially because of the hard work of individuals that went in and vaccinated all of the small villages around the world, okay? So we no longer have naturally occurring cases of smallpox in the U.S. Now, I'm going to go through natural disease for smallpox. It's very similar to chickenpox, where you transmit the virus by the respiratory route. It enters the respiratory tract, goes to the lymphatics, and causes a viremia. And just like with chickenpox, it goes to target organs, is released secondarily, again in the blood, and it's then that it causes the classic rash or pox that you see with smallpox. The disease itself, again, similar to smallpox, you have maybe a 5 to 17 day incubation period with a prodromal, just flu-like illness. You're feeling really bad. So you've got the prodrome that's followed by the rash. And what's essential to remember about the rash is that all vesicles are in the same stage of development. Okay? Now, the vesicles can and often do cover the entire body within 24 hours. Remember, because everything is in the same stage. We don't have crops of vesicles showing up like we do in chickenpox. As far as the diagnosis, it's made typically on clinical grounds, although for pathology results, you can find evidence where the virus is assembling in the cytoplasm, and those are called Guarneri bodies. So if they mention the Guarneri bodies, you'll know that that's a definitive then diagnosis for smallpox. Treatment, again, supportive care, and this has a 50% mortality rate, which is why this is up there with anthrax for one of the leading potentials for a biological warfare. Now, prevention for smallpox, again, we have a really good vaccine. It's a live attenuated strain of variola that we call vaccinia. So vaccinia is the vaccine strain for smallpox. And the thing to remember about this is because we have eradicated smallpox, we no longer vaccinate anyone for smallpox. So anyone who has not been vaccinated, which is really a good bit of the population, are susceptible to smallpox infection. all right, which also makes it a good agent for biological warfare. The next virus we're going to talk about is Molluscum contagiosum within the smallpox family. Transmission is typically by direct contact or sexual contact, and also fomites. Typically, we're looking at skin infections here where the disease is characteristic, where you'd have usually a little cluster of little wart-like lesions. They're umbilicated, so they'll have a little central depression in there, and that is very diagnostic for Molluscum contagiosum. Okay? The warts are umbilicated, which means they have that central depression. You can also find eosinophilic cytoplasmic inclusion bodies that can help you with the diagnosis. In immune-compromised individuals, this can be much more disseminated and much more severe. So whereas in a healthy person, Molluscum contagiosum is self-limiting, in immune-compromised, you would want to treat with an antiviral agent.